Introduction to pericarditis. Pericarditis occurs when the pericardial sac surrounding the heart becomes inflamed. The pericardium is a protective sac around the heart. Inflammation causes irritation, pain, and abnormal heart sounds. Fluid may also accumulate in the pericardial sac, leading to pericardial effusion. Inflammation of the pericardial sac causes friction between the layers surrounding the heart. This produces chest pain, inflammation, friction rub. Inflammation may also trigger accumulation of fluid around the heart. Severe fluid accumulation can compress the heart and reduce cardiac output. Risk factors for pericarditis. The cause is often idiopathic, meaning the exact cause is unknown.
Many cases can be treated outpatient.
Clinical presentation of pericarditis. Common manifestations include chest pain, chest palpitations, dizziness, syncopal episodes, low-grade fever, hiccups, dysphagia, recent weight loss. The hallmark assessment finding is pericardial friction rub. This is a grating, scratching sound heard with auscultation. Chest pain often worsens when lying flat, worsens with deep inhalation, and improves when sitting upright or leaning forward. NCLEX clue, pain relieved by leaning forward strongly, suggests pericarditis. CBC may show elevated white blood cells from inflammation or infection. ESR and C-reactive protein elevated due to inflammation. Blood cultures used to identify bacterial infection. Troponin I and troponin T may elevate if myocardial irritation occurs. Diffuse ST elevation is a classic ECG finding in pericarditis. PR segment depression is another characteristic ECG change seen in pericarditis. ST elevation with chest pain does not always mean myocardial infarction. Think pericarditis, especially with friction rub and positional chest pain. Echocardiogram evaluates fluid around the heart. Chest X-ray may reveal enlarged cardiac silhouette if effusion develops. Cardiac MRI provides detailed images of inflammation and fluid accumulation.
Obtain a thorough history including chest pain characteristics, autoimmune disease history, cancer history, previous cardiac surgery, and previous pericarditis episodes. Teach clients. Avoid strenuous activity for at least 3 months, monitor symptoms, and report worsening chest pain or dyspnea.
Nursing process assessment. Recognize cues by assessing chest pain, friction rub, dizziness, syncope, ECG changes. Auscultate carefully for pericardial friction rub. Diagnosis of acute pericarditis requires at least 2 of the following: chest pain, pericardial friction rub, ST elevation on ECG, new or worsening pericardial effusion. Nursing process priorities. Priority goals: reduce pain, decrease inflammation, improve cardiac output, prevent complications. Plan interventions for pain reduction, activity modification, monitoring cardiac status, and client education. Interventions include administer medications, monitor ECG, monitor vital signs, reduce inflammation, manage underlying cause.
I'm having less chest pain and my breathing feels better. My vitals seem stable.
NSAIDs reduce inflammation and pain. Examples: Advil, aspirin, Indocin. Colchicine, Colchicine, reduces inflammation and recurrence risk. Glucocorticoids used for severe inflammation. Example: Deltasone. Pericardial effusion occurs when excess fluid accumulates in the pericardial sac. As fluid increases, the heart chambers become compressed. The ventricles cannot fill properly, causing decreased cardiac output. This can become life-threatening. Fluid accumulation compresses all 4 chambers of the heart. As ventricular filling decreases, cardiac output drops, perfusion decreases, hypotension develops. Severe compression can lead to cardiac tamponade. This is a medical emergency. Risk factors for pericardial effusion. Common causes include cancer, infection, metabolic illness, cardiac trauma, and pericarditis. Clients may become anxious, dyspneic, and hypotensive. Large effusions can rapidly become fatal without treatment. Emergent intervention may be needed to prevent cardiac arrest. Blood tests evaluate inflammation, infection, and cardiac status. ECG. may show electrical alternans or low voltage. Echocardiogram, best diagnostic tool for detecting fluid around the heart. Chest X-ray may show enlarged cardiac silhouette. Perform frequent focused cardiac assessments. Assess for hypotension, tachycardia, JVD, muffled heart sounds, dyspnea. Assess bleeding risk before procedures.
Explain pericardiocentesis to the client and family.
Recognize cues by assessing for hemodynamic instability, decreased cardiac output, dyspnea, hypotension, and tachycardia. Understand that the client may rapidly deteriorate and require immediate intervention. Hypotension plus JVD plus muffled heart sounds suggests cardiac tamponade. Priority goals: improve cardiac output, maintain perfusion, stabilize hemodynamics. Plan for continuous cardiac monitoring, oxygen support, emergency intervention, preparation for pericardiocentesis. Monitor blood pressure, heart sounds, oxygenation, and cardiac rhythm. Prepare the client for pericardiocentesis. This procedure removes fluid from the pericardial sac. Evaluate whether the client has improved perfusion, has stable blood pressure, has improved oxygenation, has decreased symptoms. Outcomes may be improved, worsened, unchanged.
Pericardiocentesis. A needle removes fluid from the pericardial sac to relieve pressure on the heart.
Pericardial window, a surgical opening, allows continuous drainage of fluid. Pericarditis, inflamed pericardial sac, hallmark sign, pericardial friction rub, pain, worse lying flat, better leaning forward, ECG findings, diffuse ST elevation and PR depression, pericardial effusion, fluid around the heart causing compression, cardiac tamponade, medical emergency caused by severe compression of the heart, Beck's triad, hypotension, JVD, muffled heart sounds, pericardiocentesis, removes fluid from around the heart. Have students identify hallmark symptoms, ECG findings, emergency complications, priority nursing interventions, and treatments. Example, client with chest pain relieved by sitting forward, diffuse ST elevation, and friction rub. Correct answer, pericarditis.